Do you have joint pain? Did you know that there are different types of joint pain and arthritis? Have you ever wondered what the difference between regular arthritis and rheumatoid arthritis? This is one of the most common questions I get from my patients. Today, we'll talk about the difference between usual arthritis such as osteoarthritis and rheumatoid arthritis. When we think about arthritis, we usually think that it is something that only older people will get. But you might be surprised that the youngest patient I saw who had arthritis was only a 2-year-old baby. Obviously, the type of arthritis that 2-year-old baby can have is different than arthritis we usually see in our older grandparents. It is true that as we get older, our joint can wear out and we can get wear and tear type of damage of our joints. Our joints work really hard for us. Weight-bearing joints such as our feet, ankles, knees, and hips, and the spine need to carry body hour around and absorb the impacts from any weight-bearing activities, which is basically everything that we do when we are out, we are not lying down. These include standing, walking, running, jumping, literally anything that we do after we get up from the bed. But joints are not rock-solid hard structures. It is a structure where 2 or more bones meet and connect by joint capsules, ligaments, and tendons. Although our joint can withhold quite a lot of impacts, which is why Simone Biles can do the amazing gymnastic performance she does, the more we use them, the more we'll feel they are being used. So it is normal to feel knee pain or foot pain after doing a long hike, or back pain after carrying a heavy backpack for a long period of time. As we get older, the changes of this wear and tear can gradually add up and we can develop arthritis. This is called degenerative arthritis or osteoarthritis. As you can see, osteoarthritis is technically not a disease per se, but more of the natural process of wear and tear of the joints and aging. However, when osteoarthritis gets worse, the pain can be severe and we may need to get treatment. In future videos, I'll talk about osteoarthritis treatment as well. On the other hand, there is another type of arthritis called inflammatory arthritis. Rheumatoid arthritis or psoriatic arthritis or other type of arthritis we see in rheumatology are the examples of inflammatory arthritis. These types of arthritis is not caused by the overuse or wear and tear of the joints, but it is caused by inflammation. This is the type of the arthritis even a 2-year-old baby can develop. And inflammatory arthritis is not a technical disease of the joints. It is a disease caused by a dysfunctional immune system, which results in excessive inflammation. Joints just tend to be the easy target of the inflammatory process. Because inflammation has nothing to do with age, this type of arthritis can occur in young people, even in babies and children. If you have joint pain and wondering about what type of arthritis you have, stay tuned. I will explain 3 things that can differentiate from osteoarthritis from inflammatory arthritis. First, the relationship between the joint pain and activities. Because osteoarthritis is from overuse and wear and tear type of damage, the more you use your joint, the more pain you'll feel. However, inflammatory arthritis has the opposite tendency. In inflammatory arthritis, joint pain gets worse when you're resting and gets better when you move around. Second, the relationship between joint pain and the time. Osteoarthritis pain tends to get worse in the afternoon because your joints are being used more while you're up and moving around, using your joints and living your life. After you sleep overnight, the joint gets resting during the sleep, the pain gets better when you wake up in the morning. However, inflammatory arthritis is the opposite. The joint pain is worse when you wake up in the morning and gets better once you move around for a while. Especially morning stiffness is one of the most common symptoms of inflammatory arthritis and usually lasts for more than 1 hour. So people with inflammatory arthritis feels worse in the morning and feel better after a few hours of moving around after waking up. Third, the relationship with joint pain and other inflammatory symptoms. Because osteoarthritis is from mechanical stress to the joints from overuse and aging, you feel fine other than having the joint pain itself. However, inflammatory arthritis is from inflammation, which can spread to a whole body and cause other symptoms. Most common symptoms people feel with inflammation is fatigue and just feel under the weather and sometimes even low-grade fever. And also, according to what the underlying disease is, sometimes joint pain can come with other symptoms such as rash or abdominal pain or headache. These systemic symptoms are not usually seen in osteoarthritis. So there you go. If you have joint pain and you feel your joint pain is worse in the morning and with not moving around and comes with severe morning stiffness and other symptoms like fatigue or feeling under the weather, you need to see a rheumatologist to see if this can be from inflammatory arthritis regardless of your age. Your rheumatologist will do exams and testings to find out if it can be from inflammation or from mechanical reasons. In future videos, I will talk about what tests you can get to check what type of arthritis you have. Thank you for watching. I'll see you in the next video.